Hey everybody, welcome back to my channel. Got another video for you guys. Before we dive into it, please considering hitting that subscribe button, hit the like button, comment below on your thoughts and opinions on this article. Anyway, let's get to it. Article is here from Health IT Security, which I've made a video about this website before, focuses on healthcare cybersecurity related topics. US orgs have suffered 5,000 healthcare data breaches since 2009. More than 342 million medical records were impacted by the thousands of healthcare data breaches that occurred from 2009 to June 2022. As I said before, healthcare organizations tend to be soft or easy targets for bad guys. If you ever worked at a healthcare organization, then you probably come across something on the lines of old, obsolete systems in place. I mean, the organization that I worked for or worked at had a lot of obsolete operating systems still in place, such as Windows Server 2003, Windows 7 machines. I mean, a lot of the medical devices themselves were running Windows operating systems, and they were running on Windows 7. And the higher ups sometimes do not want to upgrade those systems due to the cost benefit analysis on those systems. But a lot of attackers know this, so they're going to target those healthcare organizations because on top of having out-of-date systems, obsolete systems in place, health organizations have a plethora of valuable information, such as HIPAA-related information, PHI, healthcare information that can be sold on the dark net or dark web for pretty good penny. All right, let's see here. From 2009 to June 2022, organizations reported nearly 5,000 healthcare data breaches to the HHS Office for Civil Rights, OCR, data breach portal. Researchers at Comparitech found the breaches impacted more than 342 million records in total. All 50 states are required to report medical breaches to the U.S. Department of Health and Human Services, with individual breaches filed if they are over 500 records. Those with fewer may be filed under a yearly report. The report noted, due to the tool only listing breaches that affect 500 or more patients, it is likely our figures underestimate the true scale of the problem, and that is correct. What they're talking about here, this data breach portal is also known as the Wall of Shame. So if you have a data breach and it falls under those requirements there, then your organization will be posted there, and then it'll be information about what happened, what kind of data breach it was, or security incident category it falls under for the whole world to see. Now you got a black eye on organization. A review of 13 years of healthcare data breaches. Nearly one-fifth of the breaches occurred in 2020 alone, likely due to the healthcare sector's focus on the pandemic, which created a perfect storm for cyber threat actors, the report found. Of course, when the pandemic had began, a lot of organizations were moving to the work from home type of work environment. On top of that, health organizations were getting hammered with, and the mass influx of patients coming in due to the disease that was around during that point. And especially during the highlight of it, I mean, stuff was just crazy, crazy. And threat actors obviously took advantage of that, which I pretty much knew was going to happen. A lot of threat actors said, hey, we're not going to target these health organizations because they're already dealing with the pandemic and all that stuff. And on top of that, it could probably cost some human lives, et cetera, et cetera. But hey, they're bad guys, right? So, of course, they're not going to listen to the laws or follow their own disclaimers out there. Let's see here. Researchers also included a state-by-state breakdown of healthcare data breaches, all based on HHS data. It is important to note that the states with the highest number of breaches are also the states with some of the highest populations in the country. Excuse me. For example, California accounted for about 10% of the 4,746 data breaches reported since 2009. Texas, Florida, New York, and Illinois fall behind it with the most affected states in terms of healthcare data breaches. Blah blah blah. Indiana accounted for nearly 25% of all impacted records at 87.2 million, largely due to the 2015 Anthem breach. That was huge. That was huge. I was still, I think I was still in school when that happened, and that was like all over the news headlines. I mean, that was pretty crazy. Apparently, that's still the biggest data breach in the healthcare industry, as you can see here. Anthem, 78.8 million records impacted, and you got Optum 360, Premier Blue Cross, Laboratory Corporation America Holdings, doing business as LabCorp, and Excelis Healthcare Plan. Top ranking medical breaches come from several years ago, so although we're seeing an uptick in the numbers of records affected on a yearly basis, this is due to higher volume of attacks rather than larger, less frequent breaches. Report noted. Much hacking incidents in recent years. Convertech found that hacking accounted for 41% of data breaches in 2021, followed by ransomware at 23%. Right. I mean, of course, ransomware is going to target healthcare industry. Like I said, they have a lot of valuable information, and of course, they can extort those health organizations. Hey, we got all this medical information, a lot of PII type of information. If you guys don't pay the ransom, then we're going to release it on the dark web or sell it on the dark web. On top of that, when they get hit with ransomware, they got all those old systems in place, and maybe their cybersecurity posture isn't up to speed. So they're going to have to invest a lot of money in those recovery operations, hiring a third party to come in, do digital forensics work, and that stuff is not cheap. And on top of that, it could cause downtime. Like if you take out the EHR system, which is electronic healthcare record system, basically that it's the system that controls like the patient information. If they take that down, then the healthcare organization will need to move off into like paper, pencil, pen and paper type of operations, which has happened. If you can just go and Google this stuff and see what happened to those health organizations, they had to move off into those or into those operations. See here. Looking forward, new report from Critical Insight confirmed that while the total number of breaches has been steadily declining since 2020, breaches are still not at pre-pandemic levels. About 20 million records have been implicated in healthcare data breaches in the first half of 2022 alone. That's a lot. I mean, that's just ridiculous. So, as healthcare organizations continue to grapple with the pandemic, 2 years later, they also have to adjust to the new normal of cyber threats, right? Like, as I said, the work from home type of thing. I mean, the new perimeter is basically on the endpoints, like laptops, et cetera, et cetera. Health organizations are likely to look quite different today than pre-COVID. For example, administrators and other support staff that don't need to physically be at the healthcare facility and might have settled into a hybrid work schedule. This creates potential security vulnerabilities. Critical Insight noted, of course. As I said, taking those laptop homes, those end devices homes, and who knows what can happen with those users doing all kinds of crazy stuff on those devices. And some organizations even allow end users to use their own personal devices to connect to the corporate network, which I think is a bad idea. It's crazy. The company should at least issue out those endpoint devices to employees so that at least it's corporate owned and they have a lot more control over it. Whereas someone's using a personal device, who knows what's going on there? It could already be infected. They could be out of date for Windows updates, could be out of date for antivirus, may not even have antivirus installed on it. I mean, users will install all kinds of crap on their machines. The report recommended that organizations get back to basics by focusing on preparing for an attack, quickly detecting attacks, and responding effectively. Additionally, health organizations should ensure that all third-party vendors are employing appropriate security measures. As I said before, I mean, it goes back to the basics. I mean, if you don't have the basics and fundamentals down when it comes to cybersecurity, then your organization is going to be in quite a predicament when they get punched in the mouth and by a cyber attacker, ransomware operators, etc. I mean, there's a lot of corporations out there, organizations out there that aren't even tracking hardware or software. Like the hardware software inventory is lacking, and that's very important. Like, how are you supposed to secure your systems if you don't know what's on them or what's out there? It's crazy. I mean, trying to keep all this different kinds of software up to date, and you're not tracking them properly in your software inventory, then it can be a nightmare. Attackers are continuing to push the envelope and change the playing field when it comes to healthcare data breaches and attacks. John Delano, healthcare cybersecurity strategist at Critical Insight, vice president at Christus Health, said in a press release, this move from large hospital systems and payers to small entities that truly have a deficit when it comes to cyber defenses shows a massive change in the victims and approach. as we continue into 2022. We anticipate attackers to continue to focus on these smaller entities for ease of attack, but also for evasion of media attention, escalation, of law enforcement. See, that's another thing. These attackers are apparently targeting the smaller health organizations. I mean, maybe those smaller health organizations don't have the budget to properly defend their systems. They don't have the budget to properly hire cybersecurity professionals, cybersecurity experts to come in and secure their systems. And attackers know this, so obviously they're going to be targeting those organizations. I mean, more bang for their buck, right? That's what they're about. They're about the money. So if they can get a good return on investment, ROI, then they're going to keep attacking and targeting those organizations. We're going to continue to see this trend, this uptick or whatever, and I don't see it getting any better anytime soon. As long as these health organizations continue to fail in their cyber defense capabilities, then these attacks are going to continue to happen. It's just good for business for these bad guys, honestly. Anyway, if you got anything from this video, if you enjoyed this video, please consider subscribing to my channel. Hit the like button, comment below on your thoughts and opinions, and I will get back with you with another one. Thank you.